To begin our program, I would like to ask if you would to please put your smartphones on vibrate. We have an evening of excellence and excitement. I don't want you to miss anything because someone is Snapchatting you or texting or tweeting you or whatever those things are. My children are teaching me those things. So I would like to say welcome to one and all, and thank each and every one of you for coming out tonight to help us to commemorate the 25th year of the Office of Minority Health and Health Disparities. Tonight's, and that's a big accomplishment. Tonight, we will honor some special people who are doing awesome and amazing things in our community and here in the state of North Carolina to advance the health of all North Carolinians. So, the office would like to acknowledge and celebrate the efforts of students, community members, organizations, and health professionals that are effectively at the, and I have to say at the grassroots, in our clinics and our hospitals, helping to make a difference. So we want to welcome you again. We appreciate you for attending tonight's event, and we hope that after this time that you will continue to be a part of the Office of Minority Health for the next 25 years. So at this time, I would like to welcome Dr. Betsy Tilson, who is the North Carolina State Health Director.
Thank you, and thank you to Cornell for, I don't know where he went, but inviting me, there he is, and letting me join you all tonight. This is really special and a big treat for me. As was said, I do have the privilege of serving as the State Health Director and also the Chief Medical Officer for the Department of Health and Human Services. So in that role, and on behalf of the whole Department of Health and Human Services, I wanted to send greetings and welcome and a huge thank you and appreciation for all of the work that you all do every day. I've only been in this role for about a month, and so as you can imagine, it's been a big learning curve, and I'm drinking from the fire hose and learning a lot, things I didn't expect to learn, but I'm learning a lot. And one of the things I'm learning is a little bit of coping strategies. And so as you can imagine, there's a lot of competing demands and really difficult decisions you have to make, and late nights and pressure. And so in that instance, there's a little bit of a mantra people will say was, not everybody gets to do this. And sometimes it meant a little bit of as a levity, a little bit of a joke, but also it's a little bit of a recognition of the importance and the gravity of the work that we do. But I had that in my head, and when Cornell invited me and I got to meet the Surgeon General, I'm not sure where she is, but I said, not everybody gets to do this. It really is a privilege and an honor. So it's great to be able to use that mantra in a little bit of a different setting and one that is maybe a little bit more positive and authentic. I hope many of you know, but in the department there is a huge focus on the determinants of health, the true determinants of health. And as we know, clinical care is only about 20% of that, and I am a physician, so I'll own that. But only 20% really of our health is that clinical care. And so when we really think about the true determinants of health, the social determinants of health, the structural determinants of health, and getting into institutional and policy issues that affect that, we get to health equity, or maybe more importantly, the history of health inequity pretty quickly when we talk about the determinants of health. So the work you all are doing and the work that's going to be honored tonight is so valued and so important, and an enormous part, and your success will be the success of the department in moving forward that agenda of really addressing the determinants of health in the goal of improving the health of all North Carolinians. So thank you very much for that. And I will close by referencing another leader in this field who many of you may know. She's not a North Carolinian, but her name is Dr. Kamara Jones, who is down in Atlanta. Many of you probably know her. She's really been a leader in a lot of health equity issues. She's the immediate past president of the American Public Health Association. I've had the privilege to hear her in person several times and have Googled her and stalked her on YouTube and online. I would encourage you all to do that as well. But she has a whole toolbox of allegories and analogies and really tools that people can communicate some of these difficult issues that are hard. It's hard to talk about racism. It's hard to talk about disparities. It's hard to talk about equity. And she has a great toolbox of communications. And one tale that she has is called the Gardener's Tale. I don't know if anybody's heard it, but I won't do it justice. You should hear her say it herself. But very briefly, that there is a vision of two flower boxes. One flower box has old soil that is replete of nutrients. Nobody's nourished it. It's another flower box full of new soil, lots of nutrients, lots of fertilizer. And then seeds are planted in both flower boxes. The seeds that's in the soil that's full of nutrients, the strongest seeds grow strong and vibrant, but the weakest seeds still get about middling height. The flower box with that replete soil, the weak seeds die, and the strongest of the seeds only get to that middling height. And I think there's a lot of analogies, a lot of discussion, a lot of conversation we could have around that, but for me, one of the most compelling piece of that analogy is thinking about the loss of potential. Think of all those seeds that if we had them and planted in a rich soil, they would be able to really reach their full potential. And thinking about our society and the lack of as a society, if we had all those seeds reach their full potential, what that would mean for not just the person, but our communities, our state, our nation, and our global as a whole. So I thank you for all the work that you are doing. I thank you for all the enrichment of the soil that you're doing, and just thinking about as you're doing that you're giving all those seeds that opportunity to grow to their full potential from which we'll all benefit. So thank you, and thank you for all the work that you do.
Thank you, Dr. Tilson, and we're just so happy and delighted to have you here with us in the state of North Carolina. And just wait, we'll be stalking you, okay? Now, ladies and gentlemen, please help me welcome the Executive Director of the Office of Minority Health and Health Disparities, Mr. Cornell P. Wright. I was so excited.
Good evening. Good evening. Sorry to make Lisa that nervous. You sound like a broken record. Disparities. It is so wonderful and just awesome to see everybody here. It's a dream come true. Just amazing. You just don't know. The 2.5 years that I've been in this office, this was a plan from day one. So let's give yourselves a hand. This is going to be a difficult time. Just so many people that deserve praise and credit for the work they do around North Carolina. And so before we even get to that far, I want to make sure that we just take time to pause. Think about the people who helped us get here. Think about the people who have suffered and sacrificed to get us here. And even more recently, the people that we've lost or that are suffering right now due to natural disasters or just being poor. We don't talk about the poor enough, but let's take a moment just to remember them silently. Thank you. So, I want you to understand that we had a monstrous task to pick out the people who we're going to honor today. And so I would like everyone who was nominated that's in the room to please stand so you could recognize these awesome cadre of people that we have in front of us. Please stand. Now, I also want you to understand that we have a surprise for the people who just stood. They may not know this, but each award that we're giving out tonight is named after someone who has done amazing work here in North Carolina. We have a community award that we're going to give out named after Reverend Richard Joyner. Please stand. We have an organizational influence award that we're giving in the honor of Dr. Sharon Elliott Bynum, if her family would stand. We have a Student Rising Star Award that is in the honor of Larry Keith. With his daughter, please stand. We have an Early Career Award named after Dr. John Hatch. And last but certainly not least, we have a Distinguished Career Award that is named after Dr. Laura Gerald. So very quickly, because I don't want to be between you much longer, between you and your food. I ate extra early, so I wouldn't have to eat now. Quick history about our office. 25 years ago, the office was started. There's a need that has been unmet for years and continues to be unmet properly. The office scratches the surface to at least get down to the root of the issues. Now, our office was not the first office to be started like this. The Heckler Report was a report that came out from the federal government that really unearthed some of the more recent struggles of Black and people of color and minorities in this country regarding their health and their morbidity and their death. So in North Carolina in 1987, there was a report by the State Center for Health Statistics done that did the very same thing for North Carolina. 5 years later, this office was born as the North Carolina Office of Minority Health. So as you are basking in the glow of the greatness around you, feel free to take your mobile device out and take pictures. The only thing that I ask is that you use the hashtag NCOMH25. I'll say it again. Hashtag NCOMH25. Y'all got it? Y'all got it? Yes. I don't see anybody snapping any pictures. So we have some great leadership here tonight, and I would like all the leaders, I'm not even going to call everybody out individually, because you know who you are. If you're a leader in your room, so that mostly is everybody in the room, I want you to stand up and clap and take pictures and have great fellowship as we get directions to what we're going to do next in terms of dining. But I want you to stand up if you're a leader in this space, working in health, helping to eliminate health disparities using health equity strategies, or you facilitate this being done in one way or another, or you support people that do that. I want you to stand up, pull your phones out, take a picture, and use the hashtag. Thank you.
would like to invite Ms. Tanya Bass to come and introduce our keynote speaker for tonight. Oh, there you are. Hey, Ms. Bass.
Good evening, everyone. Thank you for attending our 25th anniversary banquet here in the Office of Minority Health and Health Disparities. It's a pretty interesting occasion for me. I was talking to Cornell earlier this year about things coming back full circle. And so this is my second time serving in the Office of Minority Health and Health Disparities. And it's really exciting to start this second time around in this way. So I'm really excited. I feel like this day, it's been a day. For some of you know why. But it's also been a day of greatness. I ran into someone at the elevator or the bathroom, and I said, I'm satisfied with where I am today. If I died right now, it'd be okay, because I've been filled with the presence of greatness, and a lot of this presence has been greatness in public health. So I first acknowledge my mom, who is my first health and sexual health teacher, who's here on tonight. Greatness in terms of Dr. Hatch, Dr. Laverne Reed, Barbara Pullen-Smith, Dr. Laura Gerald. I can just go on. And then the icing on the cake is I get to introduce Dr. Elders. Just sitting in her presence earlier today just brings you kind of to emotions, because you think about where someone else has been and where you're trying to go for yourself. And so it just makes me really excited to be here tonight. So I know most of us know Dr. Elders, but I'll just give you a few snippets from her bio, if that's okay. Dr. Elders is a native of Shaw, Arkansas. Dr. Elders is the oldest of 8 children, now Professor Emeritus of Pediatric Endocrinology. At the University of Arkansas School of Medical Science. Dr. Elders never saw a physician prior to her first year in college. At the age of 15, she received a scholarship from her church, and she actually could attend college at Philander Smith College in Little Rock, Arkansas. Upon graduation at age 18, she entered the U.S. Army as a first lieutenant and received training as a physical therapist. Dr. Elders attended the University of Arkansas Medical School on the GI Bill. And after graduation, she was an intern at the University of Minnesota in Minneapolis and did pediatric residency and endocrinology fellowship at the University of Arkansas Medical Center in Little Rock. So as she ascended the academic ladder to full professorship, and after her fellowship and board certification in 1976, she also holds a Master of Science degree in biochemistry. Talking about smart, right? Dr. Elders, what many of us know her most for, was nominated as Surgeon General of the United States Public Health Service by President Clinton on July 1st in 1993, confirmed by the Senate September 7th, and sworn in on September 8th. Happy anniversary. Dr. Elders served in this post until January 1995, which she returned to the University of Arkansas Children's Hospital until her retirement on June 1998. Dr. Elders has many accolades and many accomplishments, and I know that I love her dearly as a role model and someone that I can look up to. So without further ado, I'd like for us all to please welcome Dr. Elders to the stage.
Thank you. I'm getting old and slow. But I'm still going. Everybody tells me every day you're above the ground after a certain age is a good day. So I'm still above the ground. I'm moving slow, but I'm still above the ground. First of all, I'd like to certainly thank Mr. Cornell, Wright, and Tanya, for inviting me to be a part of your 25th anniversary Health Equity Award. I know you look back over these past 25 years and think of all the wonderful things you've done. Think of what you've accomplished and all the things you want to accomplish and didn't, all the things you're going to accomplish. And when we heard about these wonderful awards, people receiving them and who they were named after, we knew that this was really people who understood the meaning of health care equity and what it means to deal with disparities. I know that we all often hear about disparities and feel, well, you know, that we don't have disparities anymore. Well, of course, if you say that, you've obviously had a head in the ground and don't want to pull it out yet because they're still there. We talk about all of our isms. We all have a certain number of isms on our back. And we know that we'd like to all get rid of them, but they're still there. And I certainly want to thank the people, and we all want to thank the people who are receiving these awards and for all they've done to make a difference in North Carolina, make a difference in your communities, make a difference for individuals. And I think that that's really the real important thing. I often tell people the thing I wanted to do. They often ask me, why did I go into public health and doing some of the things I did? I said I wanted to get rid of poverty, ignorance, and enslavement. And you know, the greatest cause of poverty, ignorance, and enslavement is children becoming parents before they become adults. And so most of you know that's why I really worked hard on most of my life and trying to make a difference with other health issues. Mr. Bill Taverner is certainly a health educator whom I've known and who's really been out there working very hard to try and educate people on trying to teach people about sexual health, and had a major meeting here in North Carolina this evening. And I want you to know there was 15 young women that was there, and they came up to my room and we had a girls' meeting. And that was, and so I thought that was just a real pleasure and a highlight that I was supposed to come down to where they were meeting, but I said, listen, why don't you all come up to my room? And the hotel was very nice. They had water and cheese, and so we had a girls' meeting. So the other thing the other person that I want to recognize is the person here in this room. She's in North Carolina now, been here for quite a few years, but she gave me my first federal grant when I went into public health, and really making a difference for children with diabetes in public schools and the things we could do. And I thought that we did some things that are still going on. In fact, some of those little pamphlets that we put out for bus drivers, that was back in the old days, but we was given NPH insulin, had peak effect at 3:30 in the afternoon. Well, that was fine, but the kids were on the bus, and the schools they couldn't have a snack, and they couldn't even chew gum. So they would have seizures instead. So, but anyway, we corrected a lot of that and made a big difference. And so, Francis, stand up. You got to start it. So, thank you. But she got me started, and we've been going ever since. And we did a lot of good things back in the old days. We don't talk about exactly when it was. But this evening, I want to say a few things about health care equity and health disparities. And I think that, let's see, how do I do one at a time? Wait a minute. I obviously did that wrong. Oh, okay, there we go. I don't know what I put. What are the things we know? We know a lot of things. Since we know the population is changing. For one, we're getting older. I'm not, but my children often ask me, "So, Mama, are you the oldest person in the world?" And I said, well, you know, I tell them, I'm not just aging, I'm saging. The only thing you have to do to age is don't die. So, but we're getting wiser and spreading out wise remarks. So the nature of disease is changing. We're having more chronic disease, fewer acute diseases. Only about 25% of the healthcare issues now are acute diseases. The rest, so we're having more chronic diseases, but that's because old folk like me are living longer, and I'm glad. But we know that that's happening. We know that our disparities are persistent. They are still here, they're still going, and they don't go away. We have the best doctors, the best nurses, the best health care in the world. But what we know is we have a very expensive sick care system. And we don't have a health care system. We've got to focus on prevention. We've got to focus on keeping people well. We know how to take care of you if you get sick. But we've got to learn how and work harder on the things we need to do to keep you well. You've made a lot of progress. I want to tell this group that they've really made an awful lot of progress. I was looking over some of the progress you've made, that we've made in the past 10 years, 10 or 15 years, specifically, and it's related to health care disparities. So we're always talking about our problems. Let me tell you about some of our successes, or some of the successes this minority health group and some of the successes you made. We all know, and we all walk around and say, and it's been true, blacks die of a higher rate than whites from most causes, including heart disease, HIV, that's still true, cancer, homicide, black on black crime, that's still true. But since 1999 to 2014, the suicide rate for blacks was the only group that's experienced a drop. I tell people all the time, the reason blacks don't commit suicide, you can't jump out of a basement window. But anyway, but the suicide rate even are still going down. The infant mortality rate that we've all worked very hard on, everybody in public health, has decreased more than 20% among blacks since 1990, doubling the rate for whites. But that was because the rate for blacks was very, very high, but it's still going down, and we're very proud about that. And that's because of all the work that you've been out there doing. The teenage birth rate, and I'm bragging right this minute, if you'll allow me to, but the teenage birth rate since 1990 has decreased 64%. Now, that's really something. And of course, when the teenage pregnancy goes down, we know a lot of other things go down. We know health care goes down. Prison population goes down. We know that a large part of the prison population is born to teenage moms. Why? They don't know how to parent. And so I'm not saying that don't, but that's a real big reason. So I'm saying that those are real issues. Since 1900, we're always talking about the gap between blacks and whites as far as life expectancy. The gap in 1900 was 15 years. That's when a black person, and of course it's really decreased for everybody. You know, in the first part of the 19th century, the mean life expectancy rate was 49 years, and now it's 79 years. So we're proud about that. But for blacks, it's decreased 15 years. In 1990, it decreased the gap between blacks and whites was only 7 years. And in 2014, it's 3.4 years. So you've worked hard. Pat yourself on the back. I'm proud about that. The life expectancy rate for blacks is still behind. It's 75.6 years, and for whites, it's still 79 plus years. The reason why we haven't seen much of a gain for the whites is because of the opioid crisis. And of course, one of the things that slowed down in regard for blacks is because of the things that was related to HIV, which were crack cocaine, and black homicide, black on black crime. But the homicide rate for blacks even decreased 13% from 1995 to 2013. Only 28% for whites. The cancer death rate decreased more for blacks than it did for whites during that period of time. So I'm saying you worked hard, but it's beginning to pay off. In fact, you know, in the old days, this was even before Francis and I was out working hard, we used to say that black people didn't get cancer. The reason why we thought black people didn't get cancer, they didn't live long enough to die from it. So I'm saying that we can think, well, we haven't made any progress, but we have. So just look at that. So we've been closing the gap, and I want you to know I'm really proud. The life expectancy rate has been improving since 1970, primarily because of all the work you're doing, but because of Medicare and Medicaid. That was people who had access to care. We had less smoking. Again, all the work you're doing. We had fewer Jim Crow hospitals. You know, everybody could go to the hospital. I often tell people the story of my little brother who had appendicitis. Well, he had a markedly distended abdomen, obviously had a ruptured appendix. And he went to the doctor, and the doctor put in a drain and sent him home because she couldn't admit him to a white hospital. So, but that was not unusual at that time, but at least he saw him and put in a drain, and my brother became a veterinarian. But I tell people that all the time he became a veterinarian because he thought that was the way you treat people. And I told you why the life expectancy stalled from 1992 to 95 was because of AIDS and crack cocaine and other things. But if you get to age 65, if we live to get 65, there's no difference in black-white life expectancy. I want you to know that you've done a good job. Have you done enough? You've still got a long way to go. And so let's go over some of those things, and I hope I can make this slide work. See, I keep going now. What do I do? What am I doing wrong? Okay. Keep what? Well, if we don't change our direction, we're likely to end up where we're headed. That's an old Chinese proverb. So what that says is we've got to decide that we're going to change the way we're going and begin to do things just a little bit differently. You know, our world population's increasing. We're over 7 billion now, more than 325 million in the United States. And we have the most diverse population in the world. and we're the world's fattest jailer. We have more people in prison than any other country. Okay, now, she just going the wrong way. We have many different ethnic diversity groups affected by health disparity. And I don't need to name all of these. Most of you know all of those, but you know, we speak more than 28 different languages, and we're getting older, and you know, we have gender biases and every other kind. So, and we know we have culture biases, and so educational biases. We all know people with good education have better health than people with poor education. And in fact, we've known for years that you can't keep an ignorant population healthy. You've got to educate them about their health. We have disparities in the quality of health care. We have problems related to the system. We have problems related to the providers. And we have problems related to the patient. You know, we often blame other folks and other things, but sometimes it's the economic, socioeconomic status or a cultured competency of the patient. I don't need to explain, but the definition of health equity to this population, but the Healthy People 2000 defined health equity as attainment of the highest level of health for all people. Emphasize all. Achieving health equity requires valuing everyone equally with focused and ongoing societal efforts to address avoidable injustices and the elimination of health and health care disparities. I like this slide. It was designed, I think, by the public health. Probably most people in this room have seen it a few times, but I still like it. This is talking about the difference between equality and equity. In the first slide, these are 3 kids watching a ball game. You have a kid that's about 5 feet tall, 3 feet tall, and maybe a foot or 2 feet tall. You know, if the first one, if you don't do anything, he can see the ball game just fine. In the second slide, if you provide some assistance, well, now that you give the kind of assistance that they all need, and they can all look over the fence and see the ball game. That would be called equity. You know, the first kid doesn't need a box at all. The second one needs one, probably could make it without. But the third little 2-footer needs 2 boxes in order to be able to see the thing. But in the third slide, what they say, if we remove the barriers that are out there that's causing the problem, they can all see it without, and that's what we call, when we're talking about in regard to health equity. When we think of our patient, we look at the patient, the family, the community, the healthcare system, and the healthcare provider. We all take all of those people in order for us to really look at what's going on with our culture. Let's think, why is culture competence important? The perception of disease and mental illness and their cause is influenced by culture. You know, different cultures look at things differently. The belief systems related to health, healing, and well-being are rooted in culture. Culture influences our health-seeking behaviors. As you tell people all the time with black people, if you don't bleed and you aren't dead, you don't need to go to the doctor. But culture influences our acceptance, our approach to treatment, therapies, and interventions. And we have to overcome our personal biases. We all have a few on our back. The major determinants of health are social and behavioral, environment. We can often tell more by how long people are going to live and when they're going to die, how healthy they're going to be. We know more from their zip code than we know from their genetic code. So These are all important determinants. We know from 20% genetic, and we doctors think 100% of how well people do is related to that wonderful care we give, and now we're learning it's only 10%. So I'm saying that we've got to really look at what we're doing. This is a busy slide, and we aren't going to go over it, but that's the social determinants framework. They spent a few years deciding this, but they feel the health care, education, housing, the physical environment, work environment, all of those factors that are up there very much influence health, as well as the individual, and of course our social and our economic policies. And we've all seen some policies that's influenced what's happened in regard to health. One of the things we all know that we're the only industrialized country in the world that don't provide health care for all of our people. And we should be ashamed of that. And because of that, it shows, and we pay a heavy price. We spend more money than anybody in any other country in the world. And we don't have the best health. And that's because we don't do the things to keep people healthy in our society. And those are some of the things that we've got to address and do if we're wanting to have a healthy society. Some of the factors affecting our health we know are poverty, education, our risky behaviors. Sometimes our behaviors affect our health as much or more than anything else. How long you live, like people smoke tobacco, drink excessive alcohol, drug and alcohol abuse. That's the opioid crisis. And of course, we talk about access to health care. Whether we have provider access, financial access, cultural access, transportation access, and of course even time access. I call this the 4 CEUs. We know the health care in America is not coherent, it's not comprehensive, we don't have choice, it's not cost effective. I told you we spend more money than anybody in the world when we're not healthy. We know it's not equitable, and it's certainly not universal. These are things that I think must address. Some of the truths I've already told you, spend more money than any other nation. We have a shorter lifespan, not healthier, and having a higher infant mortality rate. Even though our infant mortality rate has come down, we still rank number 37. So there are many other almost third world countries that have better live birth. I used to tell people, it's just because the reason why black infant mortality rate is so high is because we're poor. Well, in our education, the Hispanics are very poor in education. Their infant mortality rate was better than the white infant mortality rate. So I said, I lied. So, but we don't know. We really don't know why the black infant mortality rate is so high. We know why the black infant mortality rate is high because we have more premature babies. The greatest cause of infant mortality rate is premature babies. And so if you have a lot of premature babies, then you're going to have a lot of high infant mortality. So, I mentioned smoking was going down, and like me, I eat too much and exercise too little. But 67% of us are overweight. 33% of our population is obese. And diabetes since 96 has increased 33%. So, but that's, increased 8%, And that's because we are eating too much. And most all people with type 2 diabetes that we know is overweight. We've done a good job with reducing strokes and high blood pressure, but not as well as we could. We're working on lack of access to health care, and I don't know what we're going to do, but maybe we're going to do something. Most of us get too little exercise. 83% of us don't eat 5 fruits and vegetables every day. And of course, we have a lack of healthcare literacy, and we don't want to teach comprehensive health education in schools because we think if we tell them about it, we'll teach them something about sex, and we tell them something about it, they'll do it as if they aren't already doing it. So I don't know why in the world we can't educate them. You all have really been doing a good job here in North Carolina, and I praise you for that. The major problems you all know with our healthcare system is access, costs too much, delivers too little, and not all quality across the board is the same. Certainly in some of our poor, rural communities, we do have a real problem with high quality health care and lack of access to all health care. What are barriers to reducing health disparities? What's the group that's most likely not to have health care? It's kind of at the 18 to 29 year age group. Oh, okay. And we know that uninsured is 6 times less likely to have a source of care. You know, they have a primary care doctor. They're less likely to have a usual source of care for financial reasons. And we know the young people of color are disproportionately affected. We've talked about our aging population, aging of our baby boomers, and about 2045, it's thought that 50% of our population is going to be non-European, non-white. So we're having increasing people of color. And of course, the fastest growing segment is we old folk, but that's because we live in longer, but I'm not ready to die yet. So, and that's just what that says is that the cost of health care we're having a widening of the gap between the rich and the poor. We talked about increasing chronic disease, but health care as a percent of our gross domestic product has increased from 5% in 1960 to 18% in 2010. So it's really has increased tremendously. Part of it is because we're getting older, and it just costs a lot more to take care of us old folk. The health goals of 2020 is we want to have a society in which all people live long, healthy lives. And that's what we aim for, and that's what we're trying to get to. What are the challenges ahead? We've done a lot. You've done a lot. But we still have a long way to go. The major health issues in the minority populations is now very much the same as in other populations, but we have a few that are we have more of. Chronic health conditions, they're not too different. Cardiovascular disease, diabetes, obesity. Alzheimer's is getting to us old, if we keep living. Physical injury, mental health. Mental health problems need to be diagnosed early. The most common problem seen in community hospitals is young people with mental health. Most of them could be diagnosed by age 14, but they aren't. And they keep ending up in the emergency room in the hospitals and going over and over. So that's not been taken care of. And so we have HIV and AIDS. We've got to find a way to make sure that we begin to address this issue. We're trying. They're having different problems, but we can't lose all of our young black men to HIV and AIDS. We've got better drugs now. It's been converted from a death sentence to a chronic disease, a life sentence with Truvada, but it's still a problem. What they're having now is more STDs because they feel that they don't have to be careful anymore. And when I put malnutrition up there, but primarily obesity. And of course, sensory impairment, oral health, substance abuse is a major, major problem in our country. One we've got to find a way to deal with. And of course, bowel and bladder issues as we get older. But I already told you we're getting fatter. That's because we are. And mental health problems, as I mentioned, mental health disorders account for 15% of the overall burden of disease. It's caused higher than cancer. And that's because it's affected 20% of all Americans, and very often it's not diagnosed. And especially in minority populations and in populations that don't have a doctor and can't go see the doctor. And treatment is available for many of these disorders, and they're just not treated. So, as I said, 50% of lifetime mental disorders began by age 14. 75% began by age 24. So what we've got to do is diagnose them early to try and really begin to make a difference if we are going to really address these disorders. Another major burden of disease is sexual and reproductive health problems. 18% of the total global burden of disease is related to sexual health. 32% women are reproductive age. And do you know how many hours we spend in medical school teaching our medical students about sexual health? 5 hours. So so we haven't educated our doctors, we haven't educated our parents, we haven't educated our teachers, we haven't educated our preachers. We've got to educate our society about sexual health problems if we're going to really make a difference. What are some of the possible solutions to health care equity problems? First of all, we've got to get the data. We've not collected, for a long while, we really didn't collect the data by races, but now we're beginning to do that. So we're beginning to collect much of the data, and so we can identify and document the problems. And then we've got to target our interventions to address those problems and address those individuals. We can't just use a broad brush and throw it out there and say, well, you get it, because see, many of these people can't read. So they can't get it. So I think we've got to look at what do we need to do to address the population we're trying to reach. So we've got to identify the population we want to reach, and then after we identify them, then we have to design programs to address those issues. I think the other thing that if we have earlier diagnosis, we know the earlier that you diagnose anything, better you can treat it. Everybody needs health insurance. We've got to educate our patients. We can't let them walk around ignorant. We've got to have more preventive health care. We spend 97% of our health care dollars on very expensive sick care. We need to spend more on preventive health care and keeping people well. The most expensive treatment we get is in the emergency room. We've got to have more monitoring and wider access to technology. We've got to have stronger primary health care. We've got too many specialists, not enough generalists. And we've got to have broader family sick leave practice, and we've got to have a social system supporting health, the social determinants, and we've got to have a team approach to care. We can all care. When we care, we have the courage to stand up for the things we believe in. We have to be committed. When you care, you're committed. When you're committed, you give your time, your talent, your treasures. And the people who won awards today gave some of all of those. I call them the 3 T's of commitment. We've got to be consistent. And we've got to build coalitions. We've got to be aware of the problems, advocates for the problems, and develop an action plan. an action plan that's right for the community we're trying to serve. We've got to reach out and be responsible and continue to do good research. We've got to educate and empower our people so that they'll be able to do the things we know they need to do. One strategy won't do. We've got to use multiple strategies: educational strategies, access strategies, prevention strategies, intervention strategies, compassion strategies, research strategies, political strategies. We have to educate our politicians. I remember telling one of my politicians one time he was going to come down and spend some time with us, and I told him he couldn't spend a day, he had to spend a week. He was a slow learner. But he came. He spent 3 or 4 days and went back. And next year he was voted the most improved legislator that they had. Well, but he just didn't understand. So very often when people understand and know what's going on, they can really do a much better job. So I'm saying we have to make sure we educate our politicians. And when they're going out crazy, don't just call them crazy and unlearned. Go out and teach them. And of course we have to have, and that's what this group is about, that's what you're about, and that's what you've got to do. It's what I call leadership strategies. And the 5 C's of leadership are clarity of vision. If you can't visualize what you want to do, where you want to go, what you're trying to get done, you sure can't convince anybody else. You've got to be consistent. You can't say, oh, we're going to do this today. Oh, no, I changed my mind. We're going to go this way tomorrow. You've got to be consistent. It's all right if you change your mind with a good reason, but you can't just change your mind because you hadn't thought it out clearly in the first place. You've got to be competent to do the job. You may want to do it. You may have the best vision in the world, but if you're incompetent, you can't get it done. You've got to be committed. We talked about time, talent, and treasures. And somebody has to be in control. And so you have to make sure that you're in control. So as we look at, excuse me, that's all right. We're through with it. Well, let's just, I'll just cut it off. I think we're through. But if we think of our vision for the 21st century, what we want healthy people and healthy communities. That's our vision. We want to develop and design a consumer-responsive healthcare system for all ages and all groups. We want a healthcare system that's available, that's affordable, and accessible. It needs to be patient-oriented, prevention-focused, purpose-driven, and solution-oriented. And last but not least, we need to foster individual responsibility, human dignity, improve health status, and enhance quality of life. And so I'd like to close with what I consider an old Igbo saying. It says, not to know is bad. Not to want to know is worse. Not to hope is unthinkable. But not to care is absolutely unforgivable. And we can all care. We can eliminate disparities, and we can achieve excellent equity. Thank you very much. Thank you.
Let's give Dr. Elders another hand. You feel inspired? You feel validated? You feel important? Do you feel ready? Okay, we'll see what's going on next Monday. When you wear your regular clothes, make sure that passion is still there. You know how it is. I come from an old black church where everybody want to raise their hand on Sunday, but come Tuesday, ain't nobody there. You see the same folks doing the same work all the time. And so part of why we're here tonight is to appreciate those same folks that do the same work all the time. So what we're going to do now is we're going to honor all the nominees, and then we're going to honor the winners. Y'all can hang in there with us. I think we're still good on time. All right, so first up, we're going to do this expeditiously. So you know you're a nominee, so make sure you got your space ready, clear your little area. You're going to walk up here and take this certificate and a gift. So the gift that we have comes from a North Carolinian that is a healthcare professional. She's an author. She's one of us. She also has her MPA, which I have that too. Her name is Terry Austin Jones. So what we've done is Ms. Jones has written a book called A Summer with No Ice Cream. It's a health disparities novel from the perspective of a teenager. And so what we have done is that all the nominees are going to get this book. It's our token of saying thank you. We couldn't give everybody an award, but we could give you something that's tangible and it's relevant to the work that we all do. And then Ms. Jones is here. Can you stand up? So the first one in my hand goes to actually Dr. Elders. So you can give this to Dr. Elders. She can have that. But as you come up, you'll get your certificate and a book from Ms. Jones. And if you are so inclined, she can take other orders for herself if you feel like you like the gift. So just please take it as our appreciation to all the hard work that you all do. It's not enough, but it's something that I felt would be important and so well treasured by this group here. So first up, we have Dr. Allison Matthews. Please lead her down there. Jonathan Bell. All right. Kelvin Macklin. Miss Valerie Worthy. Hilda Morris. Anita Woodley. Dr. Ophelia Garman-Brown. Jacqueline Rollins-Wynn. Cheryl Emanuel. Linda B. King. Lagenia Grider? You may not know this person, but Belinda Pettiford. Novant Health. The Ada Jenkins Family and Career Development Center. Community Health Coalition. NC Child. The North Carolina Minority Prostate Cancer Awareness Action Team. And Piedmont Health Services. And Sickle Cell Agency. So let's give everybody another round of applause. Okay, so we want to recognize, before we recognize the awardees, we have a special, well, I'm gonna wait. Let's put a pin in that. I got something special going on. I did that on purpose to make Tanya mad. Okay. So, the winner of the Dr. Sharon Elliott Bynum Organizational Influence Award is presented to the Community Health Coalition. So if you win an award, or you're nominated for an award, please take time to meet the families and the people that the awards are named afterwards, because they are in this room. So please honor and respect that right and privilege today. The Larry Keith Student Rising Star Award is presented to Mr. Jonathan Bell. The Reverend Richard Joyner Community Member Award is presented to Miss Anita Woodley. And we'll call everybody upstage after this. And people will also get a chance to take a picture with Dr. Elders. We'll put her in a chair over here. The Dr. John Hatch Early Career Professional Award goes to Dr. Allison Matthews. If you don't appreciate the history that's going on right now in this room, that's my mentor. Dr. Hatch, you look good for 88. You look good. Okay. And again, certainly last but not least, the Dr. Laura Gerald Distinguished Career Professional Award goes to Linda King, and Jacqueline Wynn. Right there. Want to give her the award so you can take a picture with it? Let's give a hand to all our winners and our nominees. So it's at this point we're going to do something special, but before we really get there, I'm taking a little executive privilege to make sure we recognize the staff of the North Carolina Office of Minority Health and Health Disparities. Please stand up. Past, present. So with that in mind, in this moment couldn't go by without recognizing some pillars in this community, especially from this office. So we're going to honor the past directors of this office. It's been my dream since I've gotten here to make sure we're all in the room, and we almost had it. But Joanne Pierce had to be called away for some community duties tonight. But this award is named not after a person, but it's named the Health Equity Icon Award. There have been 3 full-time directors of this office, and 1 person has served interim twice. So we're going to honor anybody not named me. So if we can give these to Barbara Pullen-Smith, let me re-say that. I said it incorrectly. Dr. Barbara Pullen-Smith. "13 years ago, I was an AmeriCorps Fellow out of the office of this office that I now run, and it's because of Dr. Barbara Pullen-Smith that we are here today." Yes. What you may not know, if you're new to North Carolina, is Dr. Barbara Pullen-Smith was the founding director of the North Carolina Office of Minority Health. I was working at Duke Cancer Institute in the Office of Health Equity and Disparities when I got the call that I was the final candidate, and I called her up and asked for her blessing to take this job. So thank you. Next up, we want to honor a woman who has stood in the gap twice officially, but more times than we can count. And this is Belinda Pettiford. little secret about Belinda. She's a Delta. And on Tuesdays, when she gets time, which is rare, you might find us at one of our favorite spots here in Raleigh called Winston's, getting some meatloaf on the only day that they serve it. But I want to thank them, and in her absence, Ms. Joanne Pierce. Because without them, we have no foundation. Without them, we have no leadership. And without everyone in this room working together, we have no hope to strive for a better tomorrow. So I'd like to thank everybody that came, people who wanted to come and the people who couldn't, people who had it in their hearts but not in their body to move. We pray for them, we think of them, we keep them in our positive thoughts. We love to see everyone here, but we're glad for the ones that were able to make it. So as we leave here today, we want to make sure that we're making the proper connections. Our office does not exist in a vacuum. It takes teamwork. It takes doing things that you don't want to do. It takes everything and more to be successful. But not just be successful, but to have value. If we don't have value in the things that we do, why are we doing them? So keep that in mind as we keep doing this work. There's a lot of people in here who just love to just thank and hug their neck. And if I haven't, raise your hand, I'll get to you. But let's keep this spirit going, this camaraderie, this sense of community. This is true community. It's not that stuff or that fluff you put in a grant. Y'all know what I'm talking about. It just scratches the surface of really getting to what we need to get to. And that's people. So if we're not here to help improve the lives of people that are around us every day, then I'm glad you had some good food. But I'm here to make sure that all of us in here are working together to get the job done. So thank you so much. Good night.